Hello, everyone, and welcome to this episode of Teal Talk, an ovarian cancer podcast. Teal Talk is produced by the National Ovarian Cancer Coalition. You'll hear from medical professionals, survivors, and advocates to help guide you with knowledge, confidence, and support on your journey. Don't forget to subscribe, leave a comment with topics you'd like to hear about, and follow us on social media at NOCC National. This episode of Teal Talk is made possible thanks to the support of people like you and our generous sponsors, GSK, Merck, Corcept Therapeutics, and Northwell Health.
Welcome to today's program, Teal Talk, Navigating Menopause, What You Need to Know. I'm Stephanie Taylor, the Senior Manager for Programs and Community Engagement at the National Ovarian Cancer Coalition. I am honored to have Dr. Stephanie McNally, Vice President of Obstetrics and Gynecology for the Central Region and the Director of OBGYN Services at the Katz Institute for Women's Health at Northwell Health, joining me today. Menopause is a natural transition, but for some, it comes with unexpected challenges, especially for ovarian cancer patients who may enter menopause early due to treatment. One of the things I would love for you to touch upon is pelvic floor therapy and the role it could play for those people that are going through menopause. Can you explain what is a pelvic floor therapist?
Absolutely. And for some people in the audience right now, I can feel their hesitation. Pelvic floor therapy is related to what's happening in the pelvis. So let's talk about the pelvis first, right? Definitions, like I keep saying, are important. In a woman's pelvis, you're going to have bones, you're going to have ligaments, you're going to have muscles, you're going to have organs. On the outside, there's skin. In the vaginal tissue, there is mucosa, which is a topical layer that brings hydration and actually keeps the pH vaginally in balance with yeast and bacteria. So this is the pelvis. In a menopausal transition, and especially for women that have gone through surgery, radiation, there is going to be a more significant change on that whole pelvic floor ecosystem with all of those pieces together. So individualized care is vital. When we add the pelvic floor therapist, this is a team that specifically will work on core exercises, they do bimanual or pelvic exams to help assess where is their muscle pulling, where is their muscle weakness, what kind of exercises can we do to help a woman with whatever symptom that she is having. They also help work with our management team, physicians, APPs, to see if we need to add treatment, whether it's hydration, lubrication, vaginal hormone, and sometimes even dilators. I want to talk about dilators as well, but the pelvic floor therapist is a team that's going to help work with your needs, core exercises, vaginal exams, strengthening, and it's not just a Kegel because it's all connected. And so if we focus on one area, we miss the rest. So do not be hesitant if somebody suggests pelvic floor therapy. It's done in a private space and really can help target where your muscles change. That muscle change. Remember, we talked about estrogen and it's all over our bodies. So when we're estrogen depleted, the muscle can be more tight. And so that can cause discomfort for women for multiple source of reasons, whether it's urinary, sexual health, but the pelvic floor therapist will help you with that. And then the dilators. How many of you in the audience, when you have, especially for patients that have gone through any breast cancer treatment, there's physical therapy to help with shoulders, to help with lymph drainage. If you have an injury that's more orthopedic for pelvic therapy, for PT, it's pretty high. You're going to go, you're going to do your exercises, you're going to do your resistance band. You're going to be so excited when you graduate to the next color. What we need to understand is for vaginal dilators, it's a similar process where it gets placed and it's usually a silicone graded device system where it starts small and with the appropriate lubricant. That's another thing we're going to bring up as we're closing this question out, is that it'll specifically help open and stretch the vaginal area to help women for a multitude of functionality. And you gradually increase to a level that is not painful, but that you start to feel that change. And that's where a physical therapist for the pelvic floor working in conjunction with your medical core team can be really helpful. So literally placing something vaginally for a certain amount of time, certain amount of pressure, that's where that physical therapist can be vital.
Done in a sensitive, intimate setting.
Correct. And then you'll have homework. So you'll be able to potentially do it in your own space where you have that comfort. And when you are using dilators, or even when you're having intercourse, you want to be really cautious about which lubricant you use, that short acting for an intimate event that has a specific osmolality. How much stuff is in it, basically, that is less than 1200. So, again, things to look at where labels are important, because if you are using a lubricant during an intercourse or some type of connectivity with a partner or yourself, that you want to make sure that the pH is very specific to not throw off that already very delicate vaginal balance.
Dr. McNally, that's a really great point. And before we move on, can you explain what is the difference between a lubricant and a vaginal moisturizer?
So, lubricant is an as needed intervention. A hydration suppository or moisturizer gives you a longer acting. Same things as we use for our face and our hand. Your vagina needs that same hydration and same love also. So that usually will be inserted, whether it's in some type of cream or gel form or a suppository that dissolves. It will give a more long acting hydration. So the lubricant is as needed. The hydration will be longer acting. And the other piece to this is, again, we talked about estrogen and those changes, and if it's chemically induced or if there's radiation, that lining, that thickness of the tissue is less. And so when we're looking about hydration, even the most diligent person that's using vaginal hydration, non-hormonal, may need more, because when that tissue thins, it's really hard to get to a place where you felt premenopause, pre-treatment. So again, bring it up, because sex is part of our life. Sexual health is part of our life. Do not be afraid to ask for help.
Find your voice so you can partake in intimacy, which is really something that so many women fear having these discussions, but that was extremely enlightening. And let's talk a little bit more in depth about hormone replacement therapy. This subject matter has a lot of confusion around it. Can you help break it down, what it is, who should consider it, and what are the risks and the benefits?
I think that that's our own webinar in and of itself, because it's a huge topic. And for women that have, again, gone through certain interventions, it's going to be a different counseling and individualized. So, globally, like we alluded to, there's systemic hormone therapy and there's local hormone therapy. And actually, in the menopause world, we're moving away from hormone replacement therapy and we're calling it menopause hormone therapy, or just HT hormone therapy. So, systemically, this is something that will help treat more of those head global vasomotor symptoms. And estrogen, progesterone, that combination is needed if a woman's still retaining her uterus. Estrogen alone is appropriate systemically if there's not the presence of a uterus. When we're talking about localized treatment, it's a different modality, a different dosing, a lower level of absorption that acts locally for estrogen, and it can come in multiple forms. It can come in pills, it can come in cream, it can come in ring. And then there's also that precursor to testosterone that is on the market to help with some vaginal symptoms. So systemic versus local is different. I just said that the local estrogen is a lower dose, a lower absorption. This is the key for patients that are going through or have gone through cancer treatment. There is very few cases in which local estrogen cannot be used. Yes, I said it. So when women have gone through certain treatments, or just for the general population, or if they have cardiovascular risk, local estrogen can be very effective and should be discussed. And there are very few times where it's not appropriate. The systemic is a whole other conversation based on Cancer treatment, cancer risk, cardiovascular assessment, genetic predisposition. But overall, local treatment has extremely low side effect profile. And if anything, the benefits far outweigh many of the risks. And that is including for the vaginal estrogen formulations as well as the DHEA, that precursor to testosterone. And guess what? Testosterone then gets converted to estrogen. So already connected for that vaginal local self. And then for the systemic, really needs to be individualized, where again, we talked about that WHI. Although different estrogens really probably more health benefits than negatives.
Okay, so let's expand on that for 1 second. So for the local, would that be safe for people who have had hormone dependent cancer? And is that something that they could consider?
Absolutely should be considered, should be discussed. And we haven't even talked about patients that have triple negative breast cancers because that hormone receptivity is different. And as we get more granular, there are women that have gone through certain uterine cancers that are hormonally responsive to estrogen. So it's not just the breast, it's not just the ovarian, it's a combination. And really bringing it for a discussion is something that every woman should do.
Excellent. Conversation has to start somewhere again. So, we talked about some other things that women can do: vaginal moisturizers, using lubricants during intimacy, going to pelvic floor therapy. Are there any other types of medical treatments that are available to women who are enduring menopause who don't want to go down the path of hormone therapy?
There are, and it really is this integrative, complementary approach. So, from data, big studies, we don't have a ton of information for every single supplement that is out there, every single vitamin that's out there. But if there is a benefit and people are feeling better, I think it's important for that to be individualized because there's a multitude of things on the market. Just be cautious. Is this something that's gone through rigorous scientific evaluation? Is this something that was tested on multiple women? Is this something that was tested on women in my condition that have gone through my type of treatment? So that's something that we should consider, discuss, and it's always on the table from supplements to vitamins. Acupuncture plays a really important role where there is literature suggesting and supporting that menopausal women have a decrease in vasomotor symptoms and an improvement in quality of life, whether it's related to a decrease in stress, which is a trigger for some hot flashes, or it's related to a significant change in terms of muscle balance. Pulling it apart sometimes is hard, but it's been a benefit for menopause and something to be considered. Cognitive behavioral intervention, decreasing your stress, decreasing your anxiety. Again, stress, a trigger for certain vasomotor symptoms. When it then comes to over the counter, cooling blankets, fans, air conditioning, yes, yes, and yes, if it helps you. There are companies coming out with devices that you sit on to help you cool where you don't even realize what's happening. I would say caution, but if it works and it's non hormonal, it should be helped. The other piece that we want to really bring out is that there are two FDA approved medications that are non hormonal for hot flashes for vasomotor symptoms, as well as some off label medications that are on the market that may benefit women. I think we're getting into a lot more of that in part two, but just to kind of let women know there are options specifically for those other symptoms that are non hormonal.
Excellent. Thank you so much for clarifying that. And you really have to do your homework. And before you try something, talk about it with your doctor.
Absolutely.
So, we talk about a lot of things that women can do. Could you touch upon bioidentical hormones?
Definitions, level
Pronunciation.
settings, that I love it. So bioidentical really is consistent with what does my body make or what did my body make? What is identical to what I naturally produce in my body hormonally? That's what that means. So when we're talking about bioidentical, guess what? There are FDA prescription approved bioidentical versions of estrogen and progesterone that are available to you. Going to outside pharmacies where there's compounding, which is different. Compounded means the pharmacist puts things together. It doesn't mean that it's right or wrong, but it's not regulated in the same way as our prescription bioidentical hormones.
So again, you hear about it, you hear about a discussion with your girlfriends and somebody, you need to make sure you talk to your own healthcare provider who knows your body, your health history before you navigate that system. So we talked about a lot of the symptoms, a lot of things that women can do. We talked about how it does affect us emotionally, mood swings, the anxiety, the fear, the embarrassment of it. What are some things that women can do for their mental health while they're navigating menopause?
First and foremost, realize that you don't feel like yourself. And it's the understanding of the change in how you feel. And some women have told me, I just feel like I'm outside of my body. So the acknowledgement and then the speaking. There are validated questionnaires to look at your mood and anxiety. And if those scores, which you can actually get online and self-score, are elevated, you need to then really connect with your provider to let them know, I don't feel good. So if you do any of this or you don't feel good and your scores are elevated, you need immediately to connect with somebody, especially if you feel like you can't handle it. And it's not about handling it. It's about recognizing it. And that's what women say. I can handle it. I can get through it. But don't do that in silence. Don't do that in a silo. And if these scores are elevated, if you don't feel good, speak up to it. And so these are real changes. And then after the advocacy for yourself, after connecting with the provider, we then create a plan together. What is realistic for your time frame? What are we hoping to accomplish? Do we need to add medication? By the way, some of those medications may help with vasomotor symptoms and sleep. Do we need to add therapy, group or individualized? Many things can be done. And this idea that mental health, mood changes from perimenopause, sometimes rage, it's real, but it cannot be stigmatized.
I love that. Again, you're putting a lot of people's minds at ease. Just being honest about this because there is a lot of fear and shame that comes with this subject matter. Dr. McNally, this has been such an important conversation, and I hope our listeners are walking away feeling more informed and empowered. I know I am. Menopause is a unique journey for every person, and while it comes with challenges, there are many ways to manage symptoms and maintain overall health, which you have brought to light today. Before we wrap up, Dr. McNally, I'd love to get your final thoughts on this topic.
Menopause is real. Menopause is not going away. So embrace this time in our life. And my favorite two things to say is be bold and be brave. So find your voice, your words, and then find that provider that's going to listen. Do not suffer in silence.
I love that. Be bold, be brave, and advocate for yourself. Dr. McNally, thank you so much for joining us today and sharing your expertise. This has been incredibly valuable. We hope you found today's program helpful. We look forward to next time.
Thanks for listening to this episode of Teal Talk. We'd love your feedback. Take our quick survey linked in the description or drop a comment with your questions and topic suggestions. For more information about the National Ovarian Cancer Coalition and our mission, visit ovarian.org. Until next time, stay informed, stay empowered, and take care.